Sean Connaughton, he's the big dog. He's the El Presidente. He runs the thing. This breaking, though, before we get into some of Sean's issues, Bill Bowling on the air saying that if Pete Snyder gets in the lieutenant governor's race, that he will win and be the nominee. Snyder, no word from him. I did ask him about it, if he was considering it, and he said no, that he was focused on the Gillespie campaign. But Bill Bowling said he gets in, he wins. Chris Saxman said if he gets in, he wins. So now I got two pretty formidable people saying if he gets in, he wins. I say if he gets in, he wins. But what does Sean Connaughton say?
Well, this is it's going to be an interesting year. Actually, having a lot of conversations generally in Richmond about what may happen in some of these statewide races. And I think, as we always have seen in Virginia, we're normally counter-cyclical because it's sort of the first opportunity for voters to vote their approval or disapproval about what's happening in Washington. That's sort of a normal cycle. I think this year, though, is going to drive a lot. This is going to be, maybe it's going to be more important, that kind of sentiment, because of what's happening in Washington with President Trump and Congress. I think you look and see what happens there. 6 months from now, we may be looking at, which is when the primary will occur, completely different sentiment, whether within the partisans in the party or in the general election in November. So got a lot of people running, got some great people running for governor, lieutenant governor, for attorney general. I think it's right now it's sort of hard to predict where things are going to be and where they're going to be in 6 months.
That's right. Very unpredictable, Sean. No one knows. Although we got some interesting races. Virginia, I think, is going to be a toss-up state, perhaps, for 2017, depending how things turn out. Let's get to Obamacare and repeal, replace, repeal, not replace, replace, not repeal, whatever they're trying to do. Something's going to get done. How does it affect Virginia hospitals, how this plays out, Sean?
Yeah, and this gets into, it's interesting. I've been up personally, met with almost our entire congressional delegation, Senators Warner and Kane, and all the members of the House, as well as people in the various staffs of the various committees. The question is right now is, just such uncertainty. We don't know what the plan is. And the problem isn't that there aren't plans and that there aren't concepts that they have for the replacement part. The challenge is that the way to get at it, that they view that they can get through the Senate and not have a filibuster, is go after the money first. And when you go after the money first and through these reconciliation bills, then you're really starting to going to impact the providers directly. When I say the providers, I mean the doctors and nurses, the hospitals. And so if you're going to start by going after the money, what does that mean for us? How long is it going to take for them to come with a real repeal? They can maybe repeal the money, but then when's the replacement coming? And so this is one of the reasons in Richmond right now we keep on really encouraging the General Assembly and other state policymakers, just really do no harm, stand by. Let's see what happens in Washington. If they do some of the things that they're talking about, there's going to be some dramatic impacts on state healthcare programs. In fact, what they are talking about more and more is devolving as much of the federal healthcare program down to the state level. That could impact everything that we're doing in Virginia, and particularly in Medicaid. Virginia right now is actually one of the more stringent states when it comes to Medicaid. I think we only spend about $1,700 per person for Medicaid.
Right.
When you look at people below who are eligible for it. Other states are $5,000-$6,000. Some, like D.C., I think it's almost $7,000. If they turn them into block grants, we want to make sure that obviously Virginia that we're not, I'm going to say, penalized for having a very frugal and a very strong, fiscally sound program, while other states could potentially, if you just block granted what we're doing today, you'd end up potentially leaving Virginia constantly in this hole when it comes to money. So we're just sort of working up there. We're trying to, and hopefully this weekend or this week, the House and the Senate Republicans, President Trump, and some of the other leaders are all meeting up in Philadelphia. We'll get a better idea after this as to what their real plans are, but we expect things to move pretty quick. We think they're going to have some immediate impacts on the provision of health care. In fact, we're already hearing anecdotally from a lot of health systems and hospitals that they're putting off capital investments right now just because they don't know what the future is going to bring, how long this process is going to take, and where they're going to have to potentially reinvest their money. And again, this is why we're really encouraging the General Assembly to step back from any of these major considerations regarding health care, because this is one of those times where everyone sees this coming. You see this train coming down the tracks. There's no brakes. The question is going to be is are we going to be able to get on it, or are we going to get run over by it? And again, we keep saying, let's see what's happening. Let's figure out how to respond to it. You could really, and in fact, Governor McAuliffe recently even said publicly he would anticipate that there would be the potential for a special session on health care. And we anticipate that's a possibility either at the end of this year or early next year.
So basically, Sean Connaughton, president of the Virginia Hospital Health Care Association here in Richmond, Virginia, for Virginia, you want to encourage the General Assembly to do nothing, wait and see what happens with the feds, right?
Yeah.
Because if they pass something now and the feds do something else, maybe that doesn't mesh. So it's just kind of, focus on something else, wait to see what happens at the federal level, then you can come back in 2018 and react to that.
Yeah, and come up with something that deals with access, quality, and cost. I mean, these are the things that, are really what our healthcare system is about. Some of the biggest challenges we have right now are about making sure we're getting access to all the citizens who need it, trying to lower costs, at the same time maintaining high quality. And, we're working very diligently, and providers across the country are working diligently to implement the Affordable Care Act, Obamacare. And that sort of changed the whole model, John. If I ever point something out to people, that you think about a hospital previously, it was where you went at the last resort. It's where you had an accident, give birth, need an operation. And that's what it was there for, acute care. Now hospitals have been essentially mandated that they are now to be the center of community health. And that means providing more primary care. It's providing essentially cradle to grave sorts of services. And so we've invested billions of dollars to try and meet these new requirements, and now we just don't know whether all that money was well spent or not. So we don't know what's happening. No one can predict. In fact, it was amazing going up there to the Capitol Hill up in Washington, talking to people, and they're asking me what I've heard. That's when
so no one knows.
That's when you know you're in trouble.
That's right. That's right. When they're asking you, what have you heard, and you're up there to find out what they've heard.
That's right. That's right.
Right.
So
they figure you're at the epicenter of being you're the president of the Virginia Healthcare and Hospital Healthcare Association. They figure you're at the you're on the razor's edge.
Well, that's true. That part is true.
On the razor.
That's right.
That's probably true. That's an everyday occurrence. Sean, I got to bring my favorite topic up because it's like there they go again, right? This really drives me nuts, and I call this the Heritage Foundation-driven Petri dish conservative caucus, right? It's basically they concoct these ideas that are driven by the donors of the Heritage Foundation, couched in free market mumbo-jumbo nonsense that's not even true. Here we go again, another year at the General Assembly, and we're fighting this a COPN battle. Everybody knows what that means. It's Certificate of Public Need, and it's kind of one of those things that on paper it's like, oh yeah, that's regulation, free market, let's get rid of that, and that way we can open the market up and everybody's free and it's all free enterprise and free markets and free this and free that. And let's get rid of the Certificate of Public Need, which basically means in order to open up a hospital or services, you have to, from the state, you have to be issued a certificate saying that there has to be a public need. It's regulated. Why is it regulated? Well, guess what? Healthcare is not a free market. There's no free enterprise in healthcare, because if you're a hospital and somebody comes in and they're sick or they got something wrong with them, they go to the emergency room. Doesn't matter if they have coverage. Doesn't matter if they have insurance. Doesn't matter if they have $1 in their pocket. Doesn't matter. Hospital has to take them in, take care of them. It's called indigent care. Some hospitals can be 10% of their budget, some higher depending on the area that they're in. So here comes COPN again. We've got a group of Petri dish conservatives funded by the donors that want the ability to go in and say, okay, here's a hospital in rural Virginia, Radford, or Buchanan or something, right? You're in the rural area. You're not making any money as it is because you're serving a rural area, have a high percentage of indigents there. People without insurance can't pay for it. And now this healthcare organization wants to come in and open up services right across the street that would only provide service for the most profitable pieces of the hospital. Things like MRIs and things like that, where they make a lot of profit. But see, the hospital has to compete with them. But that's the money they make in order to take care of everything else in a rural area that doesn't make any money because it's not a free market because you have to provide those services to the hospital. So here come the Petri dish conservatives again, led by Dr. John O'Bannon, my good friend in Henrico, with all these rules, Kathy Byron, whatever, and they want to get rid of COPN. Well, if you do that, it's ridiculous because then what happens is profiteers come in, same people giving these legislators money, profiteers come in, and they cherry pick only the most profitable services, thus putting the rural hospital that has to offer everything out of business. Now, somebody tell me how that is conservative logic. That is just nonsense. And what drives me, Sean, crazy is the arguments I hear. Free market, all these buzzwords: free market, free enterprise, end government regulation, free the people, free this, free that, when all they're doing is giving money to profiteers. And then they say, well, there'll be a rural carve out. Okay, so whatever you carve out, like 5 miles, 50 miles, they'll open the shop up 2 inches over the line. I mean, doesn't this drive you crazy? Or is it just me? It drives me nuts.
Well, and John, going back to something.
Well, first of all, am I right?
Oh, yeah, you're right on. I mean, our challenge is this. I mean, people, I don't think, understand that right now the average hospital payer mix is about 60% Medicaid and Medicare. The government is only paying 74 cents on the dollar for services delivered. All right, this is not a subsidy. If somebody comes in, they have Medicaid, and we provide $1 of service, we only get 74 cents for that dollar. If a Medicare patient comes in, we only getting reimbursed for 88, 89 cents on the dollar, okay? And then the average in the state across all our health systems is about 7% is free care or bad debt. People just can't pay. So you got 2/3 of your patients who are either provided essentially reduced reimbursed care or free care. And I mean, that's our challenge, is that, when you look at hospitals, not only do you have this payer mix, which is obviously not paying its full load, or at least paying for the cost of the care they get, but then we have to have services that are available 24/7. And so when you end up having an emergency room, you want to make sure if you have an emergency, there's doctors, there's technicians, there's nurses, all their equipment standing by and ready for the moment you have a car accident or somebody gets injured or somebody gets sick. That costs an enormous amount of money, and those services then are essentially being paid for by the overall portfolio of businesses that you're providing to the patients in the entire system. If you allow people to just come in and, just quote unquote cherry pick that 33% that are commercially insured, who then don't necessarily have to, they don't have to be open 24/7. They don't have to be staffed up for any sort of emergency. Then they're going to end up undermining the fundamental business model for hospitals across this state. And this is why almost 2/3 of the states still have COPN laws. Those states that have actually deregulated, most of them all have very strong public health services out there, public health hospitals. They have Medicaid, many of them expanded Medicaid. And so there's other avenues to help essentially support the hospitals and health systems in their communities. We don't have all those things in Virginia. And again, you step back, and I just pointed out before, I mean, we're spending $1,800 a person for Medicaid. Other states are paying $4,000 or $5,000. Again, who do you think is ending up then? You're passing those costs on to the hospitals, and that's one of our biggest concerns about COPN. I mean, we want to work. We want to make the system better. We think that there are avenues that we can approach to make the system work much better. But to simply deregulate and then not provide any of the financial resources and then still leave us with essentially the payer mix that we have without the financial resources are going to completely undermine hospitals across the state. And the last state, there's a reason why no one has deregulated for 20 years. The last state to deregulate was Pennsylvania. And right after that law went into effect, within 10 years, I think over 50 hospitals have gone out of business. The payer mix for those hospitals essentially went from about 2 or 3% Medicaid up to 10 or 11% Medicaid. And the number of these essentially standalone ambulatory surgery centers and others just exploded with the numbers out there. It's exactly what we don't want to see happen here in Virginia. In Pennsylvania, they have a lot of public health systems. They've expanded Medicaid. They've done all these other things. We haven't done that in Virginia. That's why we're very, very concerned. And if any of your viewers, we would love to hear from your viewers, have them come on to our website, isupportvirginiahospitals.com. We'd love to get more people involved because the healthcare is not a free market. We all know it's not a free market. And I think it's, when people end up saying that, just look at what we're doing as a government. Look at what all the mandates the governments have placed on hospitals and health systems. And we all understand that none of this is free. And somebody has to pay for it. And right now, it's all being passed on to the providers.
Repealing a certificate of public need in a state in a commonwealth like Virginia, where we have so many rural areas, is absolute insanity. And it might benefit a few profiteers in certain areas, and your urban hospitals in big metropolitan areas might be able to survive it. But you go to the rural areas, these hospitals are not going to survive. We already had one close in Virginia. And look, if you live in certain areas now, you want to get to the hospital, you're 45 minutes away, right?
Yeah, that's right.
Double that. Make it 90 minutes. You have a trauma. You can't find a trauma center. You got to go to Tennessee if you're in deep south West Virginia. That's an hour away. You have head trauma. That hour and a half, that difference, if they close, life or death, right? This is serious stuff. And so, they're going to go in their meetings, and they're going to their committee meetings, and they're going to spout off about free markets and free enterprise and free this and free that and free and it's all it's the market, and it's free enterprise, and it's capitalism, and it's nonsense because they're engaging in a false narrative and an absurd debate. It's almost surreal. It's like, oh, well, we need to free markets, free enterprise, and it's a surreal debate. It's like Alice in Wonderland with the Mad Hatter. That's what it is. It's the Mad Hatter because they don't operate in an environment with any free enterprise. Kind of reminds me of, remember Alice in Wonderland, Sean, that table with the Mad Hatter where they were having the tea with the rabbit and the mouse? That's what it reminds me of. I'm going to keep fighting it. I know you can't comment on that, Sean, but it really drives me nuts. It's like the Mad Hatter.
And, John, my issue is this. If it was a free market, then Medicaid and Medicare then pay if we provide $1 service and reimburse us for $1 service. You can't say it's a free market when we provide $1 service and we get 74 cents back or 88 cents back.
It's crazy.
And 7% of our people for free. No restaurant, no supermarket. You imagine what would happen in our system today if you walked into a supermarket and said, I know that I'm going to buy all this food, but I'm only going to pay 88 cents on the dollar, or I want it for free. And we do that in healthcare, and that's the problem. There is no such thing as a free market in healthcare.
Insane. Out of time. This is the John Fredericks Radio Network. Hey, thanks for being with us. We had a lot of fun today at Virginia Hospital and Healthcare Association. I want to thank Sean Connaughton, their big dog. Also want to thank my good friend Julian Walker for setting this up. Brought the bagels, brought the donuts, brought the coffee. He is the man. Not only that, but he brought it at 5:30 in the morning. my hero. We're out of here. I wonder what Trump's already signed.